And this is a public interest law center that seeks to achieve substantive equality and social justice in South Africa. Nontsikelelo, good morning to you and welcome to the show.
Good morning, and thank you for the opportunity to speak with you and your listeners.
Yes, quite interesting because I was given this article, which is comment and analysis on better spending and how it can improve emergency medical services in the Eastern Cape. And looking at South Africa, the landscape that we have in South Africa, uh, quite a large rural community, many villages right across, spread right across the length and breadth of the country. And looking at Eastern Cape, and this is what I found so interesting in terms of the scenario that was created for writing or for commenting on this analysis, and for us to appreciate why this article and why we're talking about improving emergency medical services. It's important to understand some of the background, some of the incidents that have taken place that has led you and I think it's what Tokozile Motsolongo who had basically to write this piece or to comment on this piece.
That's right. Rural contexts are quite difficult to navigate and manage. We work in the Eastern Cape and in Limpopo, and we see that services, as you can understand, it's quite difficult to deliver emergency medical services across such vast distances and such terrible terrain, essentially. And what it requires is consistent planning. The thing that was shocking for us, we've been working in the Eastern Cape since 2013 as part of the Eastern Cape Health Action Crisis Coalition. And what has been shocking for us is that in that time, emergency services have not improved. And we've been doing the advocating and actually showing how easy it could be to be delivered. Section 27 did analysis of the budget of the Eastern Cape Health Department and found in the years of 2014-15 to 2018-19, that there was an underspend of about 47 million rand in terms of what the department could have spent on emergency services. And so for us, that's baffling because the money is there, and the taxpayer is giving the money to the department to be able to deliver services to the most vulnerable communities, and they're just simply not doing it. So when we did this analysis, we wanted to understand what the issues were, obviously, and then what the impediments were. And so we looked at their annual reports, and they understand what the impediments are. They know that it is about purchasing the right number of vehicles and the right kind of vehicles. The story that we tell in this article is about this young man. It's an actual story where this young man was stabbed at a village gathering, and he died because an ambulance didn't get there in time. And for us, that's what's heartbreaking, is that the effect is felt on the people who are expecting these services, and actually the Constitution guarantees for them to have them. And so that's why we wanted to look at this, the scenarios that we painted, and see how we can help the Eastern Cape Health Government meet their obligation.
Well, Nontsikelelo, what I found very interesting also is when one looks at what is available in these rural areas, and basically it is confined to possibly somebody who has just had basic first aid training. And obviously we know that would help to an extent. But in the case, like for instance, about this young man who is stabbed, it certainly is not enough. And the key issue here is, you can only go so far as first aid training is concerned. But when it comes to serious matters, when it comes to stabilizing a person, when a person requires, a lot more than just basic first aid training, it is problematic.
Absolutely. What really needs to happen is that we need to train more paramedics, and we need to staff our ambulances with 2 people who are trained in not only basic life-saving, training, but also with intermediate life-saving skills and advanced life-saving skills. And the shocker is that the Eastern Cape Health Department has actually underspent in the training colleges, so in actually putting people through the system to be trained as paramedics. They haven't been doing that consistently for the last 5 years. And that's why we have the medical legal issues that we have in the Eastern Cape to the tune of 29 billion that the state is being sued.
Yes, and also whatever you do is one requires a strategy, one requires a plan. And what you're highlighting in your piece is this is an uncoordinated or an incoherent effort on the part of the department, and this is how they've been approaching provision of emergency medical services.
Unfortunately, or fortunately for the community of Kohamouth, they have a coordinated committee, the CLIC and MM committee. And these people have been advocating since 2013 to get their ambulance and their clinic. And they've been pushing. So what's happened is that the department is like, we're going to keep these, we're going to make this community happy. So we're going to put an ambulance in their community. But what about the community, the next community and the other one who haven't got a coordinated committee? So this is the thing, it's very reactive. What needs to happen is proper planning and assessment of the requirements of the province across the entire the province, in all of the 7 districts, so that we know what we need to provide and then systematically do that. We understand that there are budget constraints. And so an illustration that I used in the article is a small one. It costs about 600,000 Rand to procure an ambulance and staff it. And so they understand about 600,000 Rand purchasing machinery and equipment. That could have been redirected to just one more ambulance into the system. And that's the kind of pre-planning and visionary administration that we need in the Eastern Cape now.
Well, you're talking about money, and there was a time when money was available. And we found that the department, and according to your analysis and your research, they had actually underspent. So the money was made available, yet they went ahead and did not spend as they should have.
This is why we said that it's uncoordinated and incoherent, because there are areas in the department's budget that are way overspent and others that are way underspent. And so we have, the opportunity, and this is why we put out this series about Eastern Cape Health Reimagined, is that the previous administration, at least the head of the administration, has now been shifted out of that department. And we have somebody called Dr. Zungu who has come in as an acting head. And this is the opportunity for this new head to look at historical failures and see that they can fix them. And this is why we are putting forward this kind of information, and you can expect to see articles coming out in relation to other areas of the Eastern Cape Health system. Just to say, here are the gaps. You know how to fill them. This is what needs to be done. It needs to be coordinated planning of using the budget where it's required.
Definitely. And all of it requires a holistic approach. And this is very important for us to understand that there are standards that need to be set. There are standards that we have, national standards, and maybe provincial standards, depending on each province's own particular circumstances, dynamics, location, the rural communities, and the like. Now, all of that obviously needs to be taken into account. But in applying or in adopting this holistic approach, it's not only about equipment. It is about personnel. It is about training. It is making sure that, your human resource strategy, which is absolutely critical to make sure that you've got the right people skilled, qualified for the job, and at the same time making sure that they adequately trained as well. So basically, we're talking about a complete overhaul of the system in as far as emergency response is concerned.
That's absolutely true. And in fact, it's not just about emergency services. It's about the entire health system. It's about looking at staffing hospitals with competent managers who have the power to be able to make decisions. And you'll see when we talk about facilities in a future article that are some of the things that will come out, will emerge. As you say, it's a holistic viewpoint that is required. And that's why the head of department of the Eastern Cape Health Department is such a critical role. And for us, it's about making sure that the proper person, the right person with the right skills is in that position, not a political appointee, but somebody who can get their hands dirty and make sure that the right people are in the right places to deliver healthcare. Because ultimately, it's about the health of our people, and it's constitutionally required.
Well, Nontsikelelo, I must say thank you very much for coming on and sharing what you have with us this morning. And clearly, it has been quite an eye-opener, and I'm sure there's still a lot more effort, a lot more work that lies ahead for you and your colleagues in obviously highlighting this problem. But more importantly, it gets to the right ears so somebody does something about it.
That's right. We just ultimately want the health system to work in favor of the people of South Africa.
Well, thank you for that, and all the best to you. Have yourself a wonderful day, and please be safe. The time is just gone, 9:32, and when we come back, we'll be joined by Imtiaz Sayed, eThekwini Secure.
Discover the Africa of your dreams and surround